Hello, I'm Andrea Cooley, one of the owners of Des Moines Mom, and today we are continuing our series on mental health. We have been talking about all kinds of mental health and just really shining a light on the topic, as it is something that I think people are starting to talk about more and just realizing how important it is. So today we are talking with Kate Hatten from UnityPoint. She is a mental health therapist, and she's going to talk to us today about postpartum depression, which is, super important for moms to be thinking about as they are, becoming moms and bringing home babies. So thank you for being with us today, Kate.
Thank you for having me.
Yeah. So what can you kind of tell us about postpartum depression and signs of it?
Sure. So there's a lot of signs of postpartum. I think the first thing is typically it's a longer than what we would call baby blues. Baby blues are typically a couple weeks. It's kind of the crying, the weepiness, kind of the tired, exhaustion. Those are kind of what we look for with baby blues, and what we look at when it comes to postpartum. These symptoms tend to be a little more intense, and they tend to be longer. So we're thinking months, even up to a year. They tend to be more about overly anxious worry, a lot of exhaustion, withdrawing from from typical things that people like to do. They can also be something in terms of having thoughts of wanting to hurt themselves or hurt their baby, with more extreme cases. But typically it kind of mirrors baby blues a little bit, but just a little more intense.
Okay. I think that is a great description. So if you are a new mom, or perhaps if you know a new mom and you think, maybe their baby's a couple weeks, a couple months old, and it seems like they're really still struggling, what would be kind of next steps if they are concerned that they might be, experiencing postpartum depression?
Sure. So the first thing that I would typically encourage a mom to do is to, reach out to her primary care doctor, talk to that doctor about what she's going through. They can help assess firsthand on, is this just the baby blues, or if there is really some significant things happening here. They may put them in touch with a therapist like myself. They may say we need to start a regimen of medication if it's serious enough. They may encourage some outside support, like a support group or such, during that time. But it just kind of depends on patient to patient. But typically, I would say the first stop is the primary care doctor.
Okay, I think that's great. I know, personally as a mom, those first, really those first couple months are such a blur that it's easy to kind of just write off feelings of, just feeling overwhelmed and, maybe more anxious, and just say, oh, I just had a baby, like it's going to be fine.
Right.
But it is important for moms to take care of ourselves, because if we don't take care of ourselves, then we can't take care of our kids.
Right, definitely. I remember when I was pregnant, my doctor said, a happy mom will make a happy baby. And I think that's really true. We focus so much on the baby, but we want moms to be happy, because they're able to be their best self and take care of their babies the best that they need to. So I think letting moms know that this is common. 1 in 8 women suffer from postpartum, and that they're not alone in this, and that seeking out some type of assistance, whatever that may be, is really a good thing.
Yes, I think that's so important. And even just hearing that statistic that 1 in 8 women, it kind of maybe helps take away some of the shame or the mom guilt that, oh, I'm not cut out for this, or I'm not good enough. I think as moms, we're
Right,
really good at kind of shaming ourselves. Um,
definitely.
are there any, perhaps there is a woman who already before they have kids is prone to anxiety or depression. Are there things that she can do to kind of prepare herself before she has a baby?
Sure. So if I was working with a mom like this, I would really encourage her to be vocal when it comes to having a birth plan. I know birth can be really crazy and anything can go, but I really encourage a mom to be in the know about what to expect. So educating herself on the birth, What's that going to look like? What could she expect when it comes to going into labor? As much as possible, you can prepare.
Sure.
Talking with her about making sure she's eating well, that will help her, exercising, talking about any feelings, even if she's feeling maybe a little low prior to giving birth, making sure that she has support people to talk to. I would encourage any mom to have that. So there's no surefire way to avoid postpartum depression, but I think using some of these great tools, and sometimes women need medication that are safe even for a pregnancy. Sometimes women need that too, and that's okay. But I think just being able to have kind of some self-care things intact before she goes into labor, I think would be a really good thing.
Those are great tips. Definitely, just to be proactive about your health as a mom. What encouragement do you have for a mom who maybe, is in the midst of postpartum depression, or, just feeling like, I am in the thick of things and I don't feel like there's any light at the end of the tunnel. Is there, does postpartum depression, does it have an end date, or is it, permanent, I guess?
Sure. Well, and every woman's different. Every person is different when it comes to postpartum, but I would first let them know, like I said, that they are not alone in this, that there are so many women that have some struggles when it comes to having a baby. It's a huge change, huge shift. So I think I would just encourage them to know that they should rely on these people around them, support people, family, friends, partners. I would also let them know that there's help out there, and to encourage them to do what they can to take care of themselves. And, just to really reassure them that this will pass. It's a phase, just like any phase with having a child. It's going to take a little time to kind of move forward, but with the right assistance, I think we can get women into a good space after having a baby.
Great. Yeah. No, I think that is all really just good information, and good just to be aware of the possibility of it. Do you have anything else that you would add just about postpartum and mental health?
I just think it's really an important thing, whether it's a father or a mother or whomever, it's a huge shift to have a baby, and, your bodies are changing, your brains are changing, you're trying to take care of this little being. And, so I would just really encourage people to rely on the people that they love, rely on those support people, reach out when you need help. There's no shame in it. And we as mental health professionals are trained into how to help guide you in the right direction. And so just don't be ashamed to reach out. And like I said, just really know that you're not alone in this.
Yes. Well, thank you so much, Kate. I think, yeah, hormones are real, and it seems like things are not getting back to normal as quickly as they should. There definitely are lots of resources and people who are there to encourage and support you. So we hope
Definitely.
We hope this is helpful for new moms. Thank you so much for joining us today.
Thank you for having me.